new study shows bone fractures caused by osteoporosis are actually deadlier for men than for women. Our medical expert, Dr. Kevin Campbell, joins us in studio now. And we want to know, first of all, just talk a little bit about osteoporosis. What is it?
So osteoporosis is a disease where bones become weak and brittle, and it really affects almost 44 million Americans. The greatest health risk related to osteoporosis is, in fact, these broken bones. It contributes to about 2 million fractures a year, with women suffering more of these than men, but in men, they tend to be more complicated and more risky to your health.
All right, and what did this new study actually show?
So these researchers actually analyzed data from more than 1 million Americans that were age 65 and older. They had osteoporosis and suffered a fracture. This was around 2005 to 2009. And what they found was that the death rate 1 year after one of these fractures was 19% for men and 13% for women. In addition, women were 5 times more likely to suffer an initial fracture than men were, but had a slightly lower risk for subsequent fractures within the first 3 years of that break.
So who is at risk?
Well, obviously men and women are at risk, but there are risk factors that, you really want to know. One is age. Bone density peaks at age 30. So as you get beyond that, your risk increases. Gender. Women are 4 times more likely than men. Family history. Bone structure. So if you're small and thin, you could be at higher risk for osteoporosis. And if you smoke and use alcohol, also increases your risk.
So is there anything we can do to avoid osteoporosis-related fractures?
Certainly it's really especially important for young women to begin prevention early. You want to exercise. Bone density peaks at age 30. So do strength training exercises where you bear weight. Make sure you get enough calcium and vitamin D. You can talk to your doctor and they may want to prescribe supplements for you. And another thing is to get a bone density test if your doctor thinks it's appropriate. It gives you a baseline and also tells you how at risk you are.
All right, lots of good information there. Dr. Campbell, thanks so much for joining us. If you'd like to learn more about this topic, or if you have any other health-related questions for Dr. Campbell, you can find him online at WNCN.com.